The big problem we have in prostate cancer now is of one of our own making. There have been a huge increase in the number of treatment options for metastatic and non-metastatic hormone-sensitive prostate cancer, but now we have a problem of over-treating some patients and under-treating others. And it's difficult to know which patients are the ones who are going to benefit the most from additional treatment. So one way that we can look at this is trying to better understand patient prognosis, so how well the patient's going to do regardless of their treatment. And currently we use clinical variables to determine this, but they help up to a point, but they're not perfect. The same goes for my specialty, so pathology slides. We can gain some prognostic information from a histopathology slide, but it doesn't give us the whole story. So we know that there's other patterns that's going to be hidden within that tissue that can really help us understand tumour behaviour and help us understand how well patients are going to do. So to that end, we partnered with Altera AI, who've developed this multimodal artificial intelligence model that can extract data from whole slide scanned images, combine it with clinical variables, and then have built that into a deep learning based neural network which can then produce a prognostic score trained against prostate cancer specific mortality, which is one of the outcomes of our interest. So the background to this study was Altera have already developed this test in the localized disease setting, but the trial I'm associated with, STAMPEDE, has patients of much higher clinical risk and who are in greater need of understanding how best to utilise the treatment options available to them. So what we wanted to see is whether this model could be applicable to our setting.